right, welcome back. I'm Michael Stamatinos, your host for the Advancing Healthcare Innovation Show. And if you're new to us, we're just really passionate about healthcare innovation and adoption. And our aim is to bring real stories from real people on the front lines that are innovating within healthcare. And if you haven't checked this out, we've had a really awesome action-packed year with incredible guests, some great content, and even new content that's always kind of flowing out. So check us out, hit like, hit the subscribe button, and super excited today to bring Dr. Rose Hedges. She is the Nursing Research and Innovation Coordinator at UnityPoint Health. Rose, welcome to the show.
Thank you.
So I kind of want to dive in because you're a clinician, you're in innovation. Walk us through how you landed in this role, kind of give us the evolution from being bedside to what it is that you're doing today.
Yeah, so thanks for the intro. Like you said, my name's Rose and I'm a nurse. I work at UnityPoint Health in Cedar Rapids, Iowa at St. Luke's Hospital. And what I do here is I run our medical makerspace inside of the hospital. And I started my career as a bedside nurse in our ICU here. And I kind of dabbled in a couple different areas. One of the great things about nursing is that you can move areas. I worked in intensive care medicine. I worked in our informatics department, working with, computer science, and decided to go back to school and get my doctorate. And I was very curious about how we could use innovation as a tool. Big, word, right? Innovation, blanket term. How can we use it as a tool to engage our nurses at the bedside to retain them and keep them, at the bedside and doing something, just a little bit more. And so I started working with a spin-out company called Maker Health out of MIT in Boston. And we were doing mobile innovation labs that came out of my doctoral studies. And what happened here was really that clinicians, frontline staff, whether they worked in the dietary department to maintenance, nurses, you name it, we were doing projects. We were prototyping in our pop-up labs and creating devices real time to either improve workflow or care for patients. And it got to the point where we couldn't keep up with the demand of people wanting to talk about their ideas or create their ideas. So I worked with our really awesome leadership team here and said, what would it be like if we had a physical space in the hospital? And we have a great leadership team here. And they said, sure, let's explore it. Let's write a business plan. We'll head over to the foundation and see what they think about it. And we got really, really lucky. And we had a wonderful nurse, Viola Reth, who left her estate to our foundation. And we were able to use that to open a medical makerspace in our hospital. And now I get to do this full time.
That's pretty amazing. So who are your customers? When you say you get a lot of ideas that come through, can you sort of describe the swath of customers that you're working with day in and day out?
Yeah, it's really anybody inside of the hospital, clinician or not, or it could even be a patient or maybe a patient's family member, such as a parent coming to work on maybe just that one-off project that's going to help this one specific patient improve their care. So like I said, it could really be anybody, or it could be something as simple as like a workflow problem that's going on at maybe with our dietary department and restocking the unit fridges on each of the units. We are kind of a think tank, but also a prototyping place as well.
So walk me through how you prioritize, because you mentioned nurse burnout, wanting to keep nurses at the bedside, retention. I would imagine that workforce is likely a top of mind, at least it has been for a number of organizations. How do you rank and stack problems and then go ahead and kind of execute? And then if you wouldn't mind perhaps giving like an actual example of what it looks like, put things in motion.
Yeah, as far as ranking projects, so we we explore all ideas, and we actually, I'm gonna pause real quick. I know you can edit, so hold on. I'm in the lab today, so we'll just cut that part. Okay, so as far as triaging or kind of evaluating projects and things that come in the lab, we really focus on exploring all opportunities. You may say that even if I know somebody walks in with an idea that I know this will never work, like creating an invisible IV tubing, right? in my head, I know this will never work, but I want to hands-on, let's make it. And my goal is that we make it within 15 minutes so that way we can physically see their idea, right? So we have a prototype on hand and then we just keep the juices going. And everybody's projects matter. It doesn't matter who you are or what you're doing here, but it's a little bit different when you have a patient that you're working with on the floor, and maybe it could be a great example this leads into. We had a 13-year-old patient that was here with us for several days after a spinal cord injury, and her whole life she was she loved doing video games, so she PC gamed, and part of that is being able to hit the V key, the space key, and she didn't have control of her fingers yet. She just had gross motor movement, so she could kind of do this action, right? So we worked with some of her care team, specifically one of the patient care techs, Dan. He came down and said, hey, this patient would really benefit if we could help enable her to do this again. That's a very specialized single patient project, but he came down and worked on making that a reality. And so we were able to do that for her, and that was a big win for us. But projects can vary from, that single patient impact project to really something that can scale across our hospital or our health system.
You mentioned something that really sort of struck me, and you said every project matters.
Mhm.
There's something that human beings get when they feel like they've actually been listened to and heard. Is that a core value within Unity Point that
Yeah,
you make people feel valued in a sense, even if, as you said, their idea is a
yeah.
little a little off the wall, you at least make them feel listened to.
Absolutely. I would hope that would be the standard across everywhere, right? But yeah, absolutely. Of course, we want
One
everybody to
one would
feel
hope.
valued and welcome. And that's some of the best ideas come from somebody who maybe just joined the organization and asked the question of, why do we do it that way? That's some of our
Well, how do
best
you
stuff.
guys keep score? If let's say you have someone who's like a major contributor, they continuously just have incredible ideas that are implemented. Is there a way you guys praise, like a scoreboard that you keep? I'm just curious if there is something like that.
I don't think there's a score. We celebrate innovation, whether it's one time or 50, right?
Mm.
We're all innovators. We really are. So I don't know that there's a score that we keep, but we have like internal and external like sharing of projects, etc., stuff like that. So we celebrate.
Awesome. What about on the flip side?
Hmm.
Because we know innovation is really hard, and we're celebrating the wins here. What about some of the setbacks? Have there been things that come to mind where they hadn't necessarily gone your way, or and then maybe even an example of something like that? Because we're not just about the wins; we want to kind of share a real depiction of
Yeah.
what goes on.
Yeah, so the first one that comes to mind that I share this story quite frequently is when we first were starting our work with our mobile innovation lab process. I remember a very excited operating room nurse coming to me, and she was so excited that she had identified this opportunity to improve care. And she said, when we have a patient that we have to operate on their chest, we have to put the EKG patches on their back because we still have to watch their heart, but we have to watch it. But that could create a pressure point, right? Yeah, absolutely, it sure could. She's like, let's make a flat EKG patch. And I said, that sounds excellent. Let's explore this. So the first thing, of course, is always, what came before you? Let's do a quick Google search. Does it exist? Well, I think it's 3M or whoever, right? Makes flat EKG patches, of course, because that would make sense. And the best part about that is she was sharing with somebody back in the operating room who had, like ordering power or knew more about our storage rooms, that we had them in our supply room already available. And it was just an awareness issue. So was that a fail? No, not necessarily a fail, but it was kind of like a letdown a little bit, but then a win, because what we realized is that we had a process failure of just awareness of tools we had available, but we were able to kind of guide and get to that answer. So we definitely celebrate that. And it was another example of why we always ask the questions of why or can we. But as far as fails and talking about them, we're very open source here. So we want to share our stories. And throughout the lab here, we have a lot of example projects on display, right? And so we have many, many iterations. We love to talk about, we started here, we went to this, didn't work. We went to this, it didn't work. We went to this, and we talk about that, and we talk about that it's okay that we might not get it the first time or the second or the third, but together we're going to work on it to make it better. So I think we do kind of celebrate we know it's not going to happen right away, or maybe it does, but we talk about it.
And then has your perception or how you've defined innovation, has it evolved since you started the lab and what does that look like today?
What does it look like today is how my perception of innovation. So innovation to me is a little bit of a culture, but as well as it's such a blanket term to me, and I try not to use it as much as possible because I think the innovation can mean so many different things. But for me, being innovative or an innovation is really just something different than before, whether it's brand new or maybe just the way that you're using it. But I think culture plays a huge role in healthcare being innovative. And like we talked about, celebrating, the ideas, the wins, the losses, and creating that speak up culture of where it's okay to ask the questions. So maybe a little bit. I think many people think of Shark Tank or something like
Yeah.
that, right? So I have this pen and it's gonna, I touch it to skin and it tells me it's cancer. Well, that's great, and that's innovation, that's amazing, and we should celebrate those things as well. But single patient impact projects where we impacted the way we provided care to just one patient are just as important to me, and I think that more healthcare systems should celebrate that as well.
So let's talk about your team. I mean, how big is the innovation team at UnityPoint right now,
Mhm.
and where do you see it going in a year from now, 2 years from now?
Sure.
You talked about how leadership is backing this, but can you
Mhm.
speak a little bit about that?
Yeah, I don't know that I really have a lot to say about the whole innovation team and our growth structure. It's one of our core concepts that we're focused a lot on, and I don't know that I'm the right person necessarily to speak on that. UnityPoint Health is a large health system, and I work at one of the hospitals of many, but I can talk locally about our team here and how we kind of roll up into the larger innovation group of the system. So myself, and then we also have an engineer, Nick, who works in the lab with me full time Monday through Friday, and as needed based on project need. But we're a group of two, and then we have some really great interns that work with us occasionally who help facilitate movement of projects sometimes, or whether they're maybe just focused on one specific project. So that's our team is kind of in flux, but we did open in the fall of 2019. So I'm sure you're aware of kind of what happened in March of 2020. So we've kind of pivoted a lot. We hit the gate running, and we were making things, and we still have continued to have projects, every week new projects. But when COVID first hit, we were really kind of responding to the healthcare crisis as far as supply chain interruptions and new innovations that were needed that we didn't even know existed, because how do you transport a COVID patient from the ambulance bay to the ER room safely? Um, and then, as COVID kind of has waxed and wanes with different waves coming across the states, we've kind of waxed and waned too, kind of what we would assume may be normal workflow back to all hands on deck. We're making this device to help care for, whatever situation might arise. But it's been really great here, and we're still, I think, every day probably figuring out what the normal will be. So I don't know that I'll ever be able to give you a straight answer of kind of what the innovation
Yeah.
team is going to look like here.
Well, what about just communication amongst all the other health sites,
Mhm.
UnityPoint sites? What's that like amongst the innovation team, and how often do you guys do that? And to what degree is the sharing look like? To the degree that you can actually share anything like that.
Yeah, I think I actually want to answer that question and talk about how we disseminate innovation here and how it gets spread to other places. And so we have what we've called the innovation safety team. And so it's a group of individuals, at different, whether it be biomed engineering to infection prevention to risk compliance. And so we vet all of the projects that come out of our innovation lab through that before it would touch a patient kind of thing. And so that's kind of how we disseminate. As far as really spreading across the health system, it's really an as needed basis. So, of course, we're always sharing our ideas and then they kind of trickle out. One that we recently worked on was a simple flashlight that goes on our iPads for our lab department. Part of checking a patient in before you get blood work is scanning their name band. We were having problems with that, and we have iPads that do that. So they're going to buy new scanners for this process, something like $1,200. And one of our lab technicians asked the questions of, well, is it really the scanner's problem, or are we having other problems? And he came up here and worked on experimentation and kind of figuring out the problem and identified, maybe it's just that we need a different light. So we 3D printed some really, simple cases, but like $1, right? They cost $1 to 3D print something. Built, took a circuit board with LED light, push button, made these little flashlights for $3 total versus $12. And now we don't have any problems, scanning patient band. So we were able to halt the spending of buying all new scanners for our devices for this process. But projects like that happen that do scale across the system, so they kind of trickle out that way.
That's an awesome example of having one potential solution, going in and just taking a closer look. And it just sounds like within the culture, because you mentioned this before, is like there's a level of curiousness and asking questions, and that's really nice to hear. You mentioned earlier about a focus around nursing retention. I'm curious, what is it that you guys have done, or what are you doing around that? Because that just seems to be a very pervasive issue, just
Uh,
widespread all across.
Yeah, so I'm not quite ready to share my results, but they should be coming out this year. We just completed a study here, and we have some really great results on our users and kind of how that's impacted retention recruitment efforts. But I can share that the whole impetus of this work, right, was to focus on recruitment, retention, and keeping nurses at the bedside. And what we found, like in my initial research, is an engaged employee is a retained employee. So I would challenge anybody to look at what an engaged employee and what that does to your retention rates. And so we're in that pathway to kind of shed a little bit of light to the research we're doing.
Okay. And I guess how can people really follow the work that you guys are doing? I mean, it just so happens that, we've stumbled upon each other, and I want to really sort of
Yeah.
broadcast some of these successes that you guys are doing. But if people want to follow the work that you're doing, where do you guys broadcast this information, since you said that you guys are
Yeah.
an open book? I'm just curious how
Yeah,
they
for
can kind of
sure.
connect with you and follow the
Ah,
work.
we can be better at it. We can definitely be better at it, but we share on LinkedIn. We do some through our hospital's web pages like Facebook and YouTube channel, etc. We share some stuff there, but that's actually one of our interns projects for the fall is our sharing of our story. How can we be doing better at that? And so we're going to be getting some help with that. So hopefully you'll see it all over the place soon. But if anybody has any questions, I'm very happy to answer, all the questions and connect you with people to help get the ball rolling.
Fantastic. Well, I guess, we've got a lot of folks that kind of tune in as it pertains to our audience. It's, we've got some practitioners, clinicians, and then we also have digital health startups. I'm just curious, how can an innovative organization that's from the outside, approach such a large organization like UnityPoint? What do you think the best approach would be, or an ideal approach? Or maybe you don't have a silver magic bullet here, but if there's a way that someone feels like they're solving a real pertinent problem, maybe as it pertains to nurse burnout, how do you think
Mhm.
that they approach you or anyone else in the organization about that?
I think you're asking me if somebody has an idea outside of the health system, how would they get connected to us as a resource? Shoot your shot. Send an email, right? I that's my advice. I don't know that we have a clear path for that. We're still kind of figuring out what our normal is, right? After we're kind of waning out a little bit of some COVID stuff. So our primary focus is really on our patients and our community inside of our network. But we haven't really entertained the idea of let's say, Michael, you come to me and say, I have an idea for this. I think we entertain all ideas, right? Kind of thing. So we'd probably listen. Yeah. So I'd say shoot your shot and see what comes of it.
All right, so sort of kind of final question here. Wave a magic wand. We get you a room full of your key peers, not only just internal team members, but maybe all across the US, other health systems, and you've got their ear for a minute. What is like the one ask or the one thing that you would want them to take away from this conversation?
I think that hearing just some of the brief examples that I shared with the wins that we've had here by providing our clinicians and hospital staff with the tools and space to safely experiment on their ideas and how it's impacted the way we can provide care here. I hope that somebody is inspired to reach out and say, we can do that too. And I would love to help you with that, even if it's a simple email to connect you with people. But I hope that people realize that I was a bedside nurse simply studying innovation as an engagement tool, and um, all the stars aligned and all the people were supportive to be able to bring this work to an Iowa hospital. And now we're one of very few that have a nurse ran hospital makerspace. And I guess my advice is you can do it too. Start the ball.
Well, I appreciate the stories, appreciate just the level of just realness
Yeah.
about what you've shared, the good, the bad, the ugly. And so for those that are listening, if you found this content helpful for you, would you mind sharing it on social media, liking it, subscribing? It I'm grateful because it makes a difference. It makes a difference when we can actually advance healthcare forward. As you mentioned, Rose, nicely, it's hey, every project matters. And I think the more innovators, and not just people that say that they're innovating, but people that are actually doing that are doing the work, because it's hard work. The more doers that we can have in the community, the better. So I'm excited to actually have you back on the show, maybe where you can share some of the results of the study or even future studies that you do. There's an open door policy here. So appreciate it very much and catch up with you soon.